I don't know if everybody's heard this, but this is a pretty big deal. It was repeated again yesterday in the Oval Office. And that is Donald Trump saying that we should be able to take the money out of Obamacare, all this money we spent healthcare. The CEO of Blue Cross Blue Shield here in Michigan, where I live, took a pay cut last year. Nick, I don't know if you knew that. Don't feel sorry for him. He made $14.5 million in a pay cut last year. And Donald Trump says it's time to take the money away from the ACA, the Affordable Care Act. It was never affordable. It was never about care. It was always an act. And it was designed to get us to Medicaid for all or a single-payer health care system. Donald Trump says, let's stop doing that. Let's send the money straight to the American people. In fact, Anthony, go ahead, roll Bite 19, would you please? Bite 19. Here's Donald Trump.
I hope that we're going to be able to have a health care where Lindsay and I were discussing it, Jim and I were discussing it, and Katie, we discussed it. We want a health care system where we pay the money to the people instead of the insurance companies. And I tell you, we're going to be working on that very hard over the next short period of time, where the people get the money. We're talking about trillions and trillions of dollars where the people get the money. Yes, please.
And there you have it, Nick. It would be health savings accounts, which you've talked about in this program, and could specifically be used only. You can't just send money to people and say, hey, buy health insurance. Can't do that. Money might get lost. Specifically HSAs. You can buy your health insurance. You can pay for prescriptions, pay for a copay on a doctor's visit. And the insurance companies, it sounds like a good idea to me, because the insurance companies would have to compete for your business. Better services, better premiums, better insurance, period. What do you think when you hear that?
I love the idea of competition with health insurance. And I think it's ridiculous that these nonprofit health insurance companies are profiting at the levels that they are. And I think that when you look back over the last 5 years since the Obamacare subsidies have been rolling through after COVID, it's a grand experiment of a one-party payer. So anyone earning under basically $100,000 has had huge subsidies on their health insurance. And so it's been masking the price of health insurance all along this way. And now, and basically this is why the shutdown happened, is because they didn't want the failure of Obamacare to become public. They didn't want to shine the light on it.
Yeah, they didn't. And it is a failure. And it was always designed to be a failure. And here we are. So the insurance companies better pay attention to this, because they've been taking advantage of the American. They've been setting record profits for years now, Nick. Record profit year after year as the American taxpayer subsidizes them. So we'll see where that goes. Meanwhile, new IRA and 401k and HSA contribution limits, speaking of HSAs, and new 401k rules to catch up contributions for people over the age of 50. What are the new rules?
Yeah, so the IRAs are up $500. So for myself, that's $7,500. For a 401k, $24,500. That's up $1,000. The HSA is up $200. That's not as much of an increase because they increase it every single year. But here's what I want people over age 50 who are making catch-up contributions to their 401k to understand. Starting next year, the catch-ups need to be Roth only. And this is the IRS regulation. You're not allowed to do the catch-up contribution as a traditional pre-tax 401k anymore. So your 401k company must offer the Roth if you want to get that catch-up contribution.
And how much is that again?
That's $8,000 for next year. So if you are over age 50, the max is $32,500. Not bad.